Today's trunk training tip is going to be about stabilization, and stabilization should be accomplished from the abdominal cylinder, meaning the diaphragm on the top, the pelvic floor on the bottom, and the abdominal wall all the way around. And we want the diaphragm to descend down as we breathe in and create intra-abdominal pressure to turn on the whole abdominal wall and pelvic floor. That's the basics. The reason why that's important for stability is a lot of times when we move our limbs, we're not super aware of how we're moving the limbs, how we're controlling from the pelvis, how we're controlling from the trunk. So we'll do something like this. And a lot of times when we think of trunk control, we're thinking of a shortening contraction, shortening these muscles, and then shortening contraction, doing side bending, or lying on our stomach and doing extensions. So shortening contractions, and that's really not how we're designed to take care of our spine. If we breathe in and have our diaphragm descend and create intra-abdominal pressure, we support all the way around. The supine is supported in 360 degrees, and it's supported in a lengthening fashion. As we increase pressure, we increase the length of that abdominal cylinder as opposed to a compressive load, and often asymmetric compressive load. More from the back, not enough from the stomach, more from one side than the other. So we want to clear up stability, and we want you to use breathing. So the first challenge to do is figure out how to align your pelvis and your rib cage so that your diaphragm can efficiently fill that whole abdominal cylinder down into your pelvic floor and start that concept of creating support. And then we have to accomplish the idea of, can we do that and move other parts of our body? So again, we don't want you lifting your leg and doing a shortening contraction, or as we lower our leg, arch your back and have your ribs flare and your pelvis flare. We want this all quiet and stable. So we're going to use on your back support points. The first support point we're going to talk about today is the back of the pelvis. So I want you to push the back of your pelvis down and then breathe in and fill. And appreciate where you're feeling, front, sides, and back, and into the pelvic floor, maybe some, maybe not at all. And then I want you to tilt your pelvis so you're on the tip of the pelvis. You're flaring the pelvis forward and you're arching your back. Back is coming up off the table or mat. And then I want you to breathe in and fill and appreciate where you feel it. Are you feeling anything in the back, down into the pelvic floor, in the front? Typically in this position, you're just feeling the front. You might feel a little bit in the front of the pelvic floor. Then I want you to do the opposite of that. Tilt your pelvis back, round your back into the table or mat, and then your tip of the tailbone is up off. And then I want you to breathe in and fill and appreciate what you feel. And do you feel front, sides, and back? Do you feel that down into your pelvic floor? Where do you feel it? And then practice tilting back and forth to the tip and the base, and then find the center of the pelvis and push the center of the pelvis down into the mat. And it's about a 2 out of 10 intensity. And I want you to keep that intensity constant, 2 out of 10, and then do your best to breathe in and fill. And where do you feel that? Do you feel like your back is flattening into the mat? Do you feel like you're expanding out into the sides and into the front? And do you start to feel your pelvic floor stretching? Like you can do a Kegel exercise where you shorten the pelvic floor and try to stop peeing midstream, and then you breathe in and fill. And do you feel a challenge to that shortening with the lengthening pressure from your diaphragm coming down and creating intra-abdominal pressure? So the support point ideally should be the center of the back of the pelvis, and play with front tilting to the tip, tilting to the base, and appreciate where else you feel it. And do you feel it more efficiently when you're on the center of the pelvis pushing down? Become aware of that as a support point to help you figure out the uprighting, facing upright of the upper rim of the pelvis towards the rest of your trunk to start the filling, control, and coordination of your abdominal cylinder. That's today's trunk training tip, and it's going to take some practice.